pressure injuries are they're a big factor that we all look at. And firstly, they're a quality indicator of care. So they're something that everyone is very focused on. And they're generally considered a quality indicator for the nursing staff, based on our older thinking of how pressure injuries developed and evolved. However, um, you know, in a lot of hospitals, it's not uncommon to have 500 or 600 individual pressure injuries in a year. And not all of those will be serious ones, but they'll all have an impact on the patient. So, firstly, there's all of the cost of prevention. So, excluding the ones we actually cause to people, we spend a lot of money on prevention. So, we've got specialized mattresses, or we've got the higher viscoelastic foam mattresses. We've got about a 30% fleet of dynamic air mattresses. So, they're either owned or hired. Then you have someone who has to manage that, as well as the cleaning of those products and the engineering of those products. That takes quite a lot of staff support just from that logistical perspective. Um, then you have the time that we're spending, we're taking from the other care we could be providing. So, everything is a choice. And if you're talking about from a health economics perspective, we have a staffing ratio of 1 to 4 nurses in the average hospital unit. Now, every time that you're spending turning someone, dressing someone to prevent a pressure injury, that's time that maybe you're not spending looking at their psychosocial needs, preventing falls, doing physio, those other aspects of care. And which ones were the ones that the patient might appreciate the most? And they might be the things that let them go home sooner, that help them with their pain sooner. So it's always, when we do one thing, we are choosing to prioritize it. And so, what are we not prioritizing as highly because we are spending time on that? And so, I think that's the factor. And it's sort of hard to sort of exactly keep track of, because it is a key foundational care thing that nurses do. And you're not, if you don't do it, you're not going to have less nursing staff, but it means you're going to spend less time on other things. Maybe it's eating and drinking. But I also think if you look at what happens with the staff who are looking after a patient who then develops a hospital-acquired pressure injury, it's a huge emotional burden as well. So, firstly, they feel bad about it. They feel guilty about it. There's often subject to having some sort of investigation into why something went wrong, where we could have intervened earlier. Some of those things are really useful for learning and preventing in the future, but they still have a bit of an emotional toll on the team that's looking after the patient. And it certainly makes discharge planning hard. That's probably my biggest thing at the moment, is that discharging someone home with a hospital-acquired pressure injury or to another service is incredibly difficult. And so it can limit their ability to go home as quickly as they'd like.